If you've been hearing about this overnight gut cleansing drink for the past few months, the one your neighbor swears by, the one showing up in every health group you follow, how confident are you that you truly understand what it's actually doing to your body? Not just it's natural, so it must be fine. I mean, actually understand it. What it does to your intestinal lining, what happens to your gut bacteria when you use it repeatedly, and the warning signs that separate a helpful cleanse from one that's quietly damaging you. That's a question worth pausing at, and I've noticed that the people who pause at it tend to be exactly the kind of careful, thoughtful individuals who've always taken their health seriously. So the fact that you're here asking these questions rather than just following a trend, that tells me something good about you. Because here's the reality. Your digestive system is not a pipe that gets clogged and needs flushing. It is a living, bacterial ecosystem that took decades to build and can be disrupted in ways that don't announce themselves right away. Getting this wrong isn't a minor inconvenience. It can affect how you absorb your medications, how you regulate your immune system, and how your body manages inflammation. All things that matter enormously for people in their 60s, 70s, and 80s. Today, I'm going to change that. I'm Dr. Mark, and this channel exists for one reason: to give you the kind of clear, practical, honest health information that never makes it into a 10-minute appointment. And I want to start with something that happened to a patient of mine named Dorothy, because her story sets up everything we need to talk about. Before we begin, take a second and tell me your name and where you're tuning in from. I go through the comments and I genuinely want to know who I'm speaking to and supporting here. Dorothy was 74 years old, a former high school librarian from a small town in Ohio, meticulous about everything she did. She kept a health journal. She tracked her sleep. She brought a typed list of questions to every doctor's appointment. Dorothy was, by any measure, doing everything right. When she started reading about gut health after her retirement, she was methodical about it. She researched, she cross-referenced, and eventually she landed on a recipe that was everywhere. Warm lemon water mixed with a tablespoon of raw apple cider vinegar and a half teaspoon of baking soda, taken on an empty stomach every night before bed. The promise? Complete intestinal cleansing while you sleep. She committed to it fully for 6 weeks. By week 4, Dorothy was having what she described as urgent and unpredictable bowel changes. She was afraid to leave the house some mornings. She assumed she had developed something serious. She spent 2 weeks convinced she had colorectal cancer. She Googled symptoms at 2 in the morning. She was genuinely frightened. What Dorothy didn't know, because nobody had ever explained it to her, was that the combination she was taking every night was acidic enough to irritate the mucosal lining of her intestines over time, alter her gut's natural bacterial balance, and trigger exactly the symptoms she was experiencing. The real answer was something much simpler and much more manageable, but Dorothy didn't know it because nobody had ever explained to her that the gut lining isn't a surface to be scrubbed. It's a living barrier, and it needs protection, not assault. Let me explain what's actually happening inside your digestive tract when you drink one of these, quote, cleansing mixtures, because the mechanism matters enormously. Your intestinal lining, the mucosal barrier, is not like the inside of a kitchen drain. Think of it instead like a living garden wall, just one cell layer thick, covered in a protective mucus coating that took years to grow and is maintained every single day by the trillions of bacteria that live alongside it. That wall is selective. It lets nutrients through and keeps harmful things out. It is, in a very real sense, the front line of your immune system. Roughly 70% of your immune activity is tied directly to your gut. When you drink something highly acidic, like apple cider vinegar or lemon juice, regularly on an empty stomach, you are introducing a pH environment that the lower digestive tract is not designed to tolerate for extended periods. The stomach handles acid, the intestines do not. The intestines operate best in a slightly alkaline environment, And disrupting that balance doesn't flush anything. It irritates the lining, stresses the mucosal barrier, and in some people begins to alter the composition of the gut microbiome, the community of bacteria that regulates everything from digestion to mood to how well your medications are absorbed. Here's where people go wrong. Some people notice the early digestive changes and assume the drink is working, that the discomfort is the cleansing process, and they push through it for weeks. That's the most common, dangerous response because they're mistaking inflammation for detoxification. Others add more ingredients, aloe, senna, cascara, laxative effect herbs that are genuinely powerful and genuinely not meant for nightly use. Some, like Dorothy, simply stop leaving the house, losing weeks of their lives to fear that was entirely unnecessary. The right move, the one I want you to remember, is this. If a digestive remedy is causing daily disruption rather than improvement within 3 to 5 days, that is your body telling you something. Not asking, telling. Stop the remedy. Give the gut 7 days to restabilize. Then speak to your doctor before restarting anything. Have you ever experienced something similar? Trying a natural remedy and finding the side effects more alarming than the original problem? Share your story in the comments below. You might be surprised how many people are quietly going through the exact same thing. Now let me tell you about Harold. Harold was 68, a retired postal supervisor from northern Georgia, a man who had walked miles every day for 30 years on the job and who prided himself on never getting sick. Harold started a morning gut health routine that a friend at his church recommended. A glass of warm water with psyllium husk fiber stirred in, followed by a tablespoon of coconut oil. Natural, harmless, widely recommended. Within 3 weeks, Harold noticed he was getting winded walking to the mailbox. He assumed it was his blood pressure. He assumed it was the Georgia heat. He assumed it was just aging catching up with him. For 4 months, Harold quietly struggled, sleeping more, walking less, chalking it up to getting older. He mentioned it almost as an afterthought to his doctor at an annual visit in late November. His doctor asked one question, "Are you taking anything new?" Harold almost didn't mention the coconut oil because it wasn't a medication, it was just food. But he mentioned it. His doctor went quiet for a moment. Harold's lipid levels, checked 6 months earlier and completely normal, had shifted significantly. The daily tablespoon of coconut oil, extremely high in saturated fat, had been steadily stressing a cardiovascular system that was already working harder as Harold aged. The adjustment was made. The coconut oil was removed. Within 6 weeks, Harold's energy was almost entirely back. 4 months of fatigue resolved in 6 weeks. It didn't have to go on that long. But Harold didn't know, because nobody had told him that natural and harmless in any amount are not the same thing. Now, and this is critically important, I need to draw a very clear line here. Everything I've described so far, irritated intestinal lining, altered gut bacteria, digestive disruption, is uncomfortable and worth correcting, but it is manageable. There is a different category of symptom that can emerge in the same region of the body that is not a nuisance. It is a medical emergency. If you or someone you love experiences sudden, severe abdominal pain that does not pass within minutes, pain that is sharp, cramping, or feels like pressure, accompanied by vomiting that won't stop, the inability to pass gas at all, or visible abdominal swelling, you do not wait. You do not call the office tomorrow. You do not take an antacid and see what happens. You call emergency services immediately. These can be signs of a bowel obstruction or perforation, both of which can become life-threatening within hours. Digestive discomfort from a dietary change is a nuisance. Sudden severe abdominal pain with accompanying symptoms is an emergency. The gap between those two things is important. Please burn it into your memory. And if nobody has ever broken down your gut health this clearly before, hit that subscribe button, because what's coming next in this video could be just as important for your safety or someone you love. I want to talk about something that trips up more seniors than almost any other gut health topic I've encountered. And it's counterintuitive because the people who fall into this trap are doing something they genuinely believe is healthy. Many people over 60 have discovered probiotic supplements, capsules containing billions of live bacteria cultures, marketed as gut health support, available at every pharmacy, endorsed by everyone from fitness influencers to well-meaning relatives. And probiotics do have evidence behind them in specific situations for specific people in specific formulations. That's the part no one mentions. Here's where it gets counterintuitive. If you are taking an immunosuppressant medication, and many seniors with autoimmune conditions, organ transplants, or rheumatoid arthritis are, introducing high-dose live bacteria cultures is not just ineffective. In people with compromised immune systems, high-potency probiotic supplements have been linked in clinical literature to a rare but serious condition called probiotic septicemia, where bacteria from the supplement enter the bloodstream rather than staying in the gut. It's rare. It is not theoretical. Beyond that specific risk, probiotics are hiding in places that surprise people. Kombucha, enormously popular right now in health food circles, contains live cultures and can interact with certain blood thinners and diabetes medications in ways that alter their effectiveness. Certain yogurts marketed specifically as probiotic gut support contain sugar levels that matter a great deal to anyone managing blood glucose. The warning signs are quiet ones. New digestive irregularity that started around the time you began the supplement. Changes in how well your other medications seem to be working. Or a new general feeling of unwellness that doesn't trace back to anything obvious. I want you to think about someone in your life right now, maybe yourself, who has started a probiotic supplement in the last 6 months. If that person is also taking an immunosuppressant, an anticoagulant, or a diabetes medication, this is a conversation that needs to happen with a doctor. Not because probiotics are evil, not because the supplement is dangerous on its own, but because the combination without awareness creates a slow-building, preventable problem that is almost never caught early enough. There is one scenario that I don't think gets nearly enough airtime in conversations about gut health, and it directly affects seniors more than any other group. It involves something completely ordinary, being mildly ill, a head cold, a stomach bug, even a few days of not eating well because of a flare-up of an unrelated condition, a bad hip, a dental procedure, an especially anxious week. Here's what happens inside your body that nobody explains. When seniors are mildly unwell, even without fever, even without obvious GI symptoms, they frequently eat less, drink less, and their gut motility slows down. Gut motility is the rhythmic muscular movement that keeps things moving through your intestines. In younger adults, motility rebounds quickly after illness. In adults over 65, it can be sluggish for days or weeks. And during that window, any fiber supplement, herbal cleanse, or high-fiber drink you are taking as part of a gut health routine can cause a blockage problem. Not because the product is dangerous in normal use, but because the combination of slowed motility and high fiber load with inadequate water intake creates the conditions for impaction, a serious constipation that can require medical intervention. I have seen this happen to patients who were doing everything by the book. Same routine, same products. The medication didn't change, their body did. The most important question you can ask your doctor at your next appointment, and one of the least commonly asked, is this. If I get sick or have a bad few days and can't eat normally, which of my supplements or gut health products should I pause, and for how long? Most doctors will not think to tell you this unless you ask. Here's a quick question for you. Has your doctor ever given you specific instructions about which supplements to stop when you're not feeling well? Drop a yes or no in the comments, because I have a feeling most of you are going to answer the same way. I want to walk you through a scenario that plays out in homes across this country every single week, and the product at the center of it is something almost everyone considers completely harmless. You've been trying a gut health routine, a cleansing drink, a fiber supplement, a new dietary shift. Things are going reasonably well, but you're experiencing some bloating and cramping in the first couple of weeks. It's uncomfortable. So you head to the pharmacy and pick up a familiar antacid you've been using for years without a second thought. What most people don't realize is that several common antacids, particularly those containing calcium carbonate or magnesium hydroxide, interact directly with the absorption environment of the gut. If you are taking thyroid medication, certain antibiotics, or blood pressure drugs called ACE inhibitors, antacids can bind to those medications in your gastrointestinal tract and reduce how much of the medication your body actually absorbs. Your body doesn't distinguish between a prescription drug and an over-the-counter remedy. It only responds to chemistry. And the chemistry of antacids, in the presence of certain other compounds, can reduce the effective dose of your prescription medication without anyone realizing it. The organ being stressed quietly in this scenario is your small intestine, specifically its ability to absorb at the right rate and in the right environment. And the symptom you might notice is not obvious. It may simply be that your blood pressure seems harder to control lately, or your thyroid levels are drifting, and nobody connects it back to the antacid because nobody thought to ask. You do not have to simply endure gut discomfort silently while taking a gut health supplement. There are safer alternatives for managing that discomfort, but you will only learn what they are if you mention the over-the-counter products to your doctor or pharmacist. All of them, even the ones that don't feel like real medications. Let me describe something that I suspect a significant number of you have been quietly ignoring for longer than you'd like to admit. You stand up from the couch or the bed, and for just a moment, the world tilts. Not dramatically, not like the movies, just a brief, slight shift in your vision. A second or two where something feels off. Then it passes and you move on. It happens when you get up from the toilet, when you stand after a meal, sometimes when you climb stairs. You've been calling it getting older or standing up too fast. You haven't mentioned it to your doctor because it seems too minor, too ordinary. Seniors universally underreport this experience because it does seem minor. It is also one of the most statistically significant fall predictors in adults over 65 that we have. It has a name. Orthostatic hypotension, a temporary drop in blood pressure upon standing. And it becomes measurably more common in people using certain gut health supplements and cleansing drinks because many of them are diuretic, meaning they encourage your body to release fluid. In an older adult who is already slightly less sensitive to thirst signals, even mild fluid loss throughout the day shifts the blood pressure balance enough that standing up becomes momentarily destabilizing. Here's what I need you to hear. A fall at 68 is an incident. A fall at 75 can mean a fractured hip. A fractured hip in a 75-year-old carries a mortality risk within the following year that most people do not know about and that I will not minimize here. The cascade from one moment of dizziness to a life-altering injury is real, documented, and preventable. The practical fixes are straightforward. Sit on the edge of the bed for 30 seconds before standing. Hold a stable surface when rising. Increase fluid intake on days you use a cleansing product. And take any diuretic effect supplement earlier in the day rather than at bedtime. As for what to report versus manage at home, if the dizziness passes within a few seconds and is linked clearly to standing, manage it with these adjustments and mention it at your next appointment. If it lasts longer than 5 seconds, occurs while sitting, or comes with chest tightness or a racing pulse, that is a phone call today, not a wait and see. There is a behavior I see with increasing frequency among seniors who are engaged in gut health routines, and I want to address it directly because it comes from exactly the right impulse, even as it often leads to unnecessary fear and unnecessary decisions. People start checking everything. They photograph what's in the toilet. They track every meal and every symptom in a notebook. They map daily changes and become increasingly convinced that each variation signals either remarkable progress or serious danger. I understand the impulse completely. When you're trying something new and your body is responding, you want data. You want confirmation. Here's the fundamental misunderstanding driving the anxiety. The digestive system does not produce consistent output. It was never designed to. What you observe on any given day is the product of what you ate 2 to 3 days ago, how much you moved, how much water you took in, what your stress levels were, what medications you took and when, how well you slept, and a dozen other variables that shift constantly. Reacting to any single observation as if it is a reliable data point is almost always wrong. The downstream harm from this behavior is real. People stop medications because they believe their gut routine is, quote, replacing the need. They restart abandoned supplements after a good day. They restrict entire food categories based on one observation. They call their doctor in a panic over something that, in context, was completely unremarkable. Or they ignore something that genuinely warranted attention because they decided it was part of a pattern they were managing. The simple, methodical replacement for this anxious daily tracking is this. Keep a weekly summary, not a daily one. Once a week, write 4 sentences. How did your digestion feel overall this week? Any symptoms that occurred more than twice? Any that were new compared to previous weeks? How much water did you average per day? That weekly snapshot gives your doctor something genuinely useful and gives you a meaningful picture instead of daily noise. That simple shift in approach reduces anxiety, improves decisions, and gives your doctor far more useful information than daily photographs and hour-by-hour logging. And if you've made it this far and you're getting value from this, type the number 74 in the comments. It's a simple way to let me know you're here and following along. I want to clarify something that applies both to gut health supplements and to many of the prescription medications that seniors take alongside them, because the confusion about this causes genuine harm. Gut health routines, fiber supplements, and probiotic products are not rescue tools. They are not things you take on the bad days and skip on the good ones. They work, when they work, through steady, cumulative presence. The gut microbiome changes slowly. The mucosal barrier rebuilds slowly. Bowel regularity establishes itself over weeks, not hours. When people use these products reactively, taking a double dose after a difficult day, stopping entirely after a good week, they are treating a long-term process as if it were a short-term fix. And what they experience as "this doesn't work" is almost always a problem of inconsistent use rather than an ineffective product. The same principle applies with even greater force to any prescription medication you are taking. If you are on a blood pressure medication, a thyroid medication, a cholesterol medication, or a medication for any chronic condition, these are not rescue medications. They are creating a steady chemical environment inside your body. When you skip doses because you feel fine, or double up after missing one, you are not being flexible. You are disrupting the very mechanism that makes the medication effective. For any gut health supplement you are using, if you don't know whether it's meant to be taken daily indefinitely, or for a limited period, or cyclically, ask your pharmacist this week. Get a specific written answer and keep it with the product. And for any prescription medication, ask your prescriber what to do if you miss a dose, specifically for that specific drug. Write it down and keep it somewhere accessible. In the moment you forget, you will not want to guess. Guessing is where things go wrong. I want to end with what I believe is the most important point of this entire conversation. The best gut health routine is not the one with the most impressive claims. It is not the one your neighbor lost 15 pounds with, or the one that has 2 million views on a social media platform. The best routine for you is the one that works safely and consistently within the full reality of your body, your age, your other health conditions, your medications, your daily patterns, and your particular digestive history. Side effects and adverse reactions to these supplements are not a character flaw. They are not you being sensitive or weak or overly cautious. They are information. Your body is using the only language it has. When your gut responds to a cleansing drink with 3 weeks of disruption, that is not the cleanse working. That is your body telling you this particular approach does not fit your particular biology. Listen to it. Too many seniors endure these disruptions in silence because they've made an assumption. I chose this, so I have to stick with it. I paid for it. I told people I was doing it. And that assumption is not medically sound. There are almost always alternatives, adjustments, and gentler approaches, but they only become available to you if you bring the conversation to your doctor. Your doctor cannot help with what they don't know is happening. Silence is not perseverance. Suffering quietly through a supplement that isn't working for your body is not discipline. It is a setup for the day you abandon the routine entirely out of frustration, possibly alongside other healthy habits. And that is the outcome we are both trying to prevent. Your voice is part of the treatment plan. Use it. Let me leave you with the simple framework I want you to carry out of this video. If you're trying a gut cleansing drink or routine, watch for persistent digestive disruption beyond 5 days. And if you experience sudden, severe abdominal pain with vomiting or inability to pass gas, do not wait. Call emergency services. That is not discomfort. That is an emergency. If you're using a fiber supplement like psyllium husk, know that illness and inadequate water intake change everything. Have a written plan from your doctor for what to pause when you're not feeling well, because your gut's motility changes when your body is under any kind of stress. If you're adding probiotics, coconut oil, or apple cider vinegar to your daily routine, mention it, all of it, to your prescribing doctor and your pharmacist before you begin, especially if you take any medication for a chronic condition. It's just a supplement is not a reason to skip that conversation. And across all of this, drink more water than you think you need. Rise slowly. Track weekly, not daily. And never stop any supplement or prescription medication abruptly without medical guidance, because the risk in stopping suddenly is almost always greater than the risk in having a conversation. These are not complicated rules. They are the difference between a gut health routine that supports you and one that quietly works against you. You made it through this entire video, and I want to acknowledge that. That is not a small thing. It tells me you take your health seriously, not just as a concept, but in practice, in the daily choices you make and the questions you're willing to sit with. What I hope you're walking away with today is not fear. Fear is easy to generate, and it doesn't help you. What I hope you have is clarity, because clarity is what turns a bottle of supplements or a well-meaning recipe on the internet into something you actually understand, something you can evaluate, something you can discuss with your doctor from a position of knowledge rather than uncertainty. If this video helped you, share it with someone you love who's been exploring gut health products or natural remedies, because this is information that protects real people from real harm quietly, every day, in kitchens and pharmacies and medicine cabinets across this country. And in the next video, I want to talk about something that connects directly to everything we discussed today. The 5 prescription medications that seniors are most commonly taking that have gut side effects their doctors have likely never mentioned. And one of them is one of the most widely prescribed drugs in the world. The numbers are genuinely surprising, and so are the alternatives. Click the video on your screen right now, because it covers something that may explain symptoms you've been living with for years.